Hi. In this part, we will talk about facial surgery, surgical procedure. That means facial, aesthetic, cosmetic enhancement, surgical procedure. Hair transplants, brow lift, something like that. This is coming up to the facial scar. Let me go in detail one by one. Brow lift. When you age, your eyebrow start to drop. Then you get wrinkles around the eye. Naturally, everyone passing your 45, you may see this kind of appearance. So we can make you look better by doing a surgery. If you look at this picture, you'll get some idea what's happening around the eye, around the brow when you are aging. Look at this picture. The brows, where I start, where I finish, and the look it gives to your face, it look like very tiring or you look like very suspicious. After the brow lift procedure, your eyes looks brighter, your face looks brighter, and you look younger. Look at another one in a closer looks. Before and after. The before, how the brow lift, and after, how is the brow lift, and what the effect it give on your eye, and the expression and the feeling. How are other people going to visualize you? So that is brow lift, and you can see some example before and after about this brow lift surgical procedure. This is before, after. And look at the expressions, look at the beauty and the feeling they have on their face. Blepharoplasty, this is shaping your eyelids. When you are aging, you are getting, inevitably, you are getting some bags, eye bags. That is due to the skin, fat, and the toning of the muscles. So we operate, we surgically adjust this component to give a younger look, or in summary, we remove the eye bags. This is a youthful eye. Your eye should look like that. This is when you are aging. What you notice here, this line disappear and is get the back, and that give you very dull looking and old looking. So we are here to reverse this situation. So don't worry. So if you look at the upper eyelid, the fat components are here, yes, there. And you look at the lower eyelid, the fat components are here. These all are coming out when you are aging. Look at this picture. This before surgery and after surgery. And you can appreciate the changes what we did after removing the eye bags. And the changes occur around the eye. And look at the face as a whole. And if you judge the age, you can see which one looks younger or which one give you more juvenile, attractive face. Another example of blepharoplasty, before and after. Another example of blepharoplasty, before and after the lower eyelid. You have eye bags in your lower eyelids. Again, it's male patients, very common, getting the lower eye bags. Usually, the brow lift and the blepharoplasty we combine together to give a better results for you. At one procedure, we get rid of all. Facelift. This is the one surgical procedure which give you the immediate younger juvenile look. So usually our patients will get around 10 years younger look when you do this surgery. It may be more than 10 years or less than 10 years. But usually the 10 years you can expect when you do the facelift when you are around 50. Look at the pictures. This is what's happening around the mouth, cheek, and the jaws when you are aging. So when we do the facelift, we give a very clear defined jawline, lift all these structures we are sacking down because of aging. Definitely will give you around 10 or sometimes more than 10 years younger looks after this procedure. Look at this man, before and after. We lift the second part of the face, giving you a younger look. Look at this lady, before and after. Look at these pictures. All this happens when you are passing around 50, 55, 60. We are here to reverse that, to give you a younger looking appearance. Rhinoplasty, very common surgery among these youngsters in this country. They want to look nicer, attractive, and they want to make their nose looking much better nowadays. Very simple surgeries. What we basically do, rearrange the structures in your nose. We don't cut and remove or change too much. We just rearrange the structures in your nose. Look at this picture, before and after. The nose, the hump, the tip. The nose and the hump and the tip. Another example, tip. That give you attractive and a younger nose and the look. Look at this gentleman's nose. And after surgery, what you can expect here. So this is all about the rhinoplasty. Liposuctions. We remove the fat under your skin in different parts of the body and make the structure looking better. So in the face, we do this around the neck, under the chin. Before, after. Definitely you will look much attractive, much beautiful and younger. This is one, before and after. Again, before and after. Before and after. And sometime, or most of the time, we remove the fat here and deposit here. We remove the fat, this area where we don't want, and deposit the fat where we want, to give a very voluminous or youthful face. Otoplasty, your ear needs some correction. Usually the children and the teenagers. Yeah, the ear. We simply make the shape of the ear to what it should be looking. And genioplasty, that's all about making your chin nicer, shaping your chin. Look at this picture, and you can appreciate how small this chin is. We can make it look bigger. When we make it look longer or bigger, that will become well proportionate to the face, and naturally it looks nicer. Look at this again, the chin, before and after. Orthodontic surgery. This is, in simple term, the jaw surgery, making your jaw relationship better. Look at this one, and after surgery. Look at this one, and after surgery. This all before and after the jaw surgeries. Look at this examples. Look at this example, before and after. This is too much skin. We push it back and make your face nicer. Hair transplants, very fashionable nowadays. For the last 10 years, we have started to do this, and slowly we are improving. And mind you, being bald is now an option. It is not necessarily that you should get this done. I'm talking about boys. Don't worry if you have this baldness there. It's not necessary there, but it's an option. You can live with that. You can look great with that still. But if you want to have hair, that's the other option. It's like that. You are going to buy a car and you are going for one model or one brand, another brand. Both are equally good. So it's something like that. So don't get upset about that. But being bald is now an option. If you want to live with it, you are happy with your life, stay with that. And hair transplants, we need the teamwork. This is me and the nurses and 3 of my senior registrars helping me. This is the patients. This is a very easy procedure, time consuming. But we take the hair usually in this region, the back of hair, back of your scalp. Take the hair one by one. We call it graft. This is a diagrammatic picture telling you how the hair in the skin and how are we taking from with the machine. We take that, this one, this is we call graft. So this is how you look. If you want a big area, we will shave a big area and take this function with that machine, take one by one. And if you need a small area, that going to be small. Then the graft we are planting in the places where we want. For example, the front line or the vertex or side, wherever we want to plant. And this is how you will look immediately after the surgery. Immediately after surgery, you will look like this. And what can we expect? The main question is, be careful about this. Are we getting 100% results? What I mean, if I throw 100 seeds in your backyard, home garden, all these 100, are they going to grow? That is the question. You have to think about it, and we have to think about. We are trying towards to get 100 at the moment. I'm sorry, we are not. But we'll get somewhere around 70%, 60%, 80% to get hair growth. This is a before and after pictures. Not expect too much. Not only the males, females, if you have hair loss due to various reasons, you can get this treatment for you. So far, what I briefly mentioned about surgical aspect of face surgery, facial aesthetic and cosmetic enhancement procedure, the surgical aspect. Thank you very much.